Good afternoon, thanks for joining us. Now, I have an awful lot of information to give you today, so please bear with me because I'm going to take a little bit longer in my opening remarks. But I'll start with the usual update on the statistics. An additional 5 positive cases were confirmed yesterday, which takes the total to 18,264. A total of 785 patients are currently in hospital with the virus, either confirmed or suspected. That's no change overall from yesterday, but it does include a reduction of 7 in the number of confirmed cases. A total of 9 people last night were in intensive care with confirmed or suspected COVID, and that is 8 fewer than yesterday. Since 5th March, a total of 4,080 patients who had tested positive and required hospital treatment have now been able to leave hospital. And in the past 24 hours, 1 death was registered of a patient confirmed through a test as having the virus, and that takes the total number under that measurement to 2,487. And I want once again today to send my deepest condolences to everyone who has lost a loved one to this illness. And my thanks go, as always, to everyone working hard to help us through this crisis. The next part of my update today relates to the changes to rules and guidelines that will come into force over this weekend. Several of the Phase 2 changes announced last week have, of course, now happened. On Monday, most shops were able to reopen, along with many workplaces. And from the evidence I've seen, people have responded to that responsibly. So thank you to all of you for that. Today, I'm able to confirm the further changes which will take place tomorrow and next Monday. That decision is informed by our current estimate of the R number, which remains below 1 in a range of 0.6 to 0.8, and also our estimate of the number of people currently infectious and capable of transmitting the virus to others. As of last Friday, we estimate that number had fallen to 1,500. The continued low prevalence of the virus means that we can proceed with changes planned for tomorrow. That means outdoor hospitality such as pavement cafes and beer gardens can reopen from Monday, 6th July. And although tourism will not open fully until the 15th of July, self-contained holiday accommodation, for example, holiday cottages, lodges or caravans with no shared facilities, can reopen from tomorrow. We will also, from tomorrow, with one important exception that I will come on to shortly, lift the guidance advising people not to travel more than 5 miles for leisure purposes. Now, I know that many of you will be keen to travel a bit further and looking forward to going to other parts of our beautiful country. In doing that, however, please behave responsibly and follow all of the public health advice rigorously. Also, be sensitive to those living in our rural and island communities. And remember this, if you don't take appropriate care, you risk taking the virus to other places. Please do not do that. Let me turn now to the exception that I referred to a moment ago. You will recall that yesterday we reported on an outbreak of the virus in Annan and Gretna. Professor Leitch will say a bit more about that shortly. So far, 10 positive cases have been identified and a significant number of contacts are being traced and tested. As a precaution, staff at 3 workplaces with connections to positive cases are also being tested today, and mobile testing units have been deployed. We are very hopeful that this outbreak will be contained, and I should stress that there is no evidence at this stage to suggest otherwise. But until contact tracing and testing has been completed, we cannot be absolutely sure about that, and that means we must act on a precautionary basis. As a result, the advice and guidance to people in the areas of Annan, Gretna, Dumfries, Lockerbie, Langham and Canonbie is to continue to follow the 5-mile travel restriction over the weekend until the testing and contact tracing process has been completed and we are able to assess if the outbreak has indeed been contained. We'll publish the particular postcodes that this guidance applies to on social media later, and we will provide a further update on Monday. If you have plans to travel into these areas over the weekend to visit or stay, you should follow the travel advice while you are there. If you run a business in these areas, including at the Gretna Gateway Outlet Village, please be extra vigilant about hygiene and physical distancing. In addition, care homes in these areas will unfortunately not be able to welcome visitors over this weekend. And generally, to people in these areas, until we conclude the management of this outbreak, please assume that there is a higher risk of infection right now and take particular care to follow all public health advice. And remember, and I'm sorry about this, but the 5-mile limit means you should not travel to pubs south of the border over this weekend. Now, I know this will not be welcome news for people in these areas, and I am genuinely sorry about that, but this outbreak is sharply reminding us just how highly infectious COVID is and how vital it is that we proceed with real care and caution. Now, let me turn next to the issue of physical distancing and whether we can, in some circumstances, relax the 2-metre rule. We're publishing today the advice on physical distancing that the government has received from our scientific advisory group. This advice makes clear that the science on physical distancing has not changed. As the distance between people decreases, the risk of transmitting COVID increases. To quote the advice directly, there is increased risk somewhere between 2 and 10-fold in reducing from 2 metres to 1 metre. However, the advice also notes that as the number of infected individuals falls, there is less chance of any of us coming into contact with someone who has the virus, and so absolute risk is lower. It also notes that risk can be mitigated through other measures. Overall, the advisory group concludes that, and I'm quoting it again, it is ultimately a matter of policy as to what physical distance is tolerated in different environments. Taking all of this into account, the Scottish Government has reached the following conclusions. Firstly, our general advice will remain unchanged. We will continue to advise that as far as possible, you should remain 2 metres away from people in other households. Second, 2 metres will remain the benchmark for the test and protect system. That means by staying at least 2 metres away from other people, you don't just reduce your chance of getting COVID and of transmitting it, you also reduce your chance of being traced as someone's close contact and being asked to self-isolate. In addition, 2 metres distancing is a particularly important guideline for anyone in a high-risk group, for example, if you're over 70 or have an underlying health condition. So all of that will not change. However, we do recognise that there are different harms here that we must try to balance as best we can. While sticking to 2 metres has clear benefits, it also has serious economic implications, and an adverse economic impact we know can in turn have an effect on people's health and well-being. For those reasons, when we enter phase 3 of the route map, which I hope will be the end of next week, we will allow exemptions for specific sectors where agreed mitigations must be put in place. The exemptions will allow premises in relevant sectors, if they so choose, to operate within a 1 metre distance on the condition that agreed mitigations are implemented. To be clear, these will be exceptions. The general rule in law will continue to be that businesses and services must take all reasonable measures to ensure that 2 metres distancing is maintained. Ahead of phase 3, we will work with key sectors. Initially, that will be hospitality, retail and public transport, to agree the mitigations that will be required and to finalise detailed guidance. And in doing that, we will also work very closely with trade unions. The guidance will be different for different sectors. Clearly, the mitigations for a restaurant or a bar will be different to those for a hairdresser. For illustrative purposes and to allow businesses to start to plan, we're publishing today the kinds of mitigations that might be required in each sector. However, in general terms, these might include improved ventilation, perspex screens, regulation of customer flow and seating plans that reduce transmission risk. For hospitality and possibly other sectors, mitigation will also include the collection of names and addresses of customers to help with contact tracing when that is necessary. And we will also insist on clear customer information to help inform the judgments that we all make as individuals about the risks we are prepared to take. So if a business decides to operate at less than 2 metres, they should provide clear signage informing their customers that they are entering a 1 metre zone. We hope to have most guidance agreed for the start of phase 3 and ahead of the opening of tourism and hospitality from the 15th of July. But in the meantime, and let me stress this point, the current rules apply, and that means, for example, that beer gardens opening on Monday must initially comply with the 2 metre rule. Now, in my view, this represents a balanced and a proportionate approach to what is a genuinely difficult issue. It allows businesses to cater for more customers, and we know that for some that will be the difference between staying in business or closing. However, it also continues to minimise risk, which for some individuals, and with no exaggeration, could be the difference between life and death. Obviously, if infection levels were to rise again, we reserve the right to reimpose a strict 2-metre rule either nationally or locally, and to take other public health measures that are necessary to keep us safe. Conversely, though, if we continue to make progress, we may be able to consider a more general relaxation in later phases. Now, the issue of physical distancing is directly relevant to the next issue I want to talk about, which is face coverings. We have been recommending the use of face coverings for some time now, and it is already mandatory on public transport. I can confirm today that from the expected start of phase 3, which is the 10th of July next week, wearing face coverings will also be mandatory in shops. As with public transport, there will be some exemptions for children under 5 and people with certain medical conditions, but for everyone else, face coverings will be mandatory. Now, let me be very clear, this is not a decision we've taken lightly. It has taken us some time indeed to reach this decision. But as we all start to interact more, it is vital that we take all reasonable steps to reduce risk. And we know that face coverings can help reduce the risk of transmission indoors. Also, in shops, as on public transport, contact tracing is more difficult because we usually don't know the people that we have been in contact with. So a face covering provides an additional layer of protection. It's therefore for all of these reasons that face coverings in shops will be compulsory from the end of next week. But please don't wait until then. Get into the habit of it now. This is a really important way for all of us to help protect each other and to display that sense of solidarity that has served the country so well over these past few months. The final issue I want to talk about today relates to children and to young people. In a few moments, the Chief Medical Officer will provide some important information for some of the children who are currently shielding. And I want to say directly to any of you who are watching, I know how difficult, even more difficult than for others, this last period has been for you. And I want to thank you for your patience and for complying with all of these rules. The advice I'm about to give, unfortunately, does not apply to children who are shielding, but the Chief Medical Officer will say more about that in a moment. But it does apply to other children and young people. We want to help children enjoy these summer holidays a bit more. We also know that the clinical risks of COVID, particularly for younger children, appear to be relatively low, although we will never be complacent about that. And we know that for as long as there are restrictions on the number of households we can meet, families will find it difficult to balance the social needs of children and adults. Understandably, you don't all want to see the same people every day. Bearing that in mind, I'm announcing today 2 further changes to our rules to allow for a bit more interaction between young people. And these changes will both apply from tomorrow. For children who are 11 years old or under, we are removing the requirement for you to physically distance with other people when you're outdoors. That will allow you to play more normally with your friends, which I hope you will enjoy. I'm sure this move will also be appreciated by your parents and carers. However, other rules will remain the same for the next wee while. You should continue to meet in groups of 8 or less and to meet no more than 2 other households at a time. Adults who are with you should continue to observe physical distancing from each other, and physical distancing, even for you as children, is still advised indoors. Our guidance is different for young people aged 12 to 17. We're not yet relaxing the physical distancing rule for you, and I'll say more about that shortly. But we know that you don't want to be limited by who your parents can meet. You want to have your own lives and meet your own friends. So when you meet other people, we are still asking you to do that outdoors, and you should still stick to a limit of 8 people from no more than 3 households at any one time. However, we will lift the limit on the number of those meetings you can have in any one day. That means you can meet different groups of friends at different times of the day, and it also, importantly, means that you won't be prevented from meeting your friends just because your parents or carers or your brother or sister happens to be meeting their friends. As I said, for now, we're asking older children to still keep 2 metres distant from people in other households, even outdoors. I know that the advice we've published today suggests that this is less important for young people, so we do hope that this will change in the weeks to come. But initially, and for your safety, we want to act cautiously. Now, these changes are careful but important steps that I hope will make life just a little bit easier and also perhaps a little bit more fun for children and young people. I hope next week to set out more changes, not just for children but for adults as well, to how households can meet, interact and play. And I also hope to confirm at that stage that organised outdoor contact sports for children can resume from the 13th of July. However, I hope that these changes do allow you as children and young people a bit more freedom in meeting up with your friends, and I hope they allow you to make a bit more of the summer holidays, even if, as will probably be the case in Scotland, it's raining for much of the time. Lastly, I also hope to give more clarity next week about when places of worship might be able to reopen for communal prayer and congregational services. I had a very constructive discussion yesterday with Scotland's main faith groups, and we will be engaging with them more in the days ahead. I know how committed they all are to the safety of their congregations, and I want to give an assurance of the Scottish Government's desire to see people of faith able to gather together for prayer and worship again just as soon as possible. Now, as is obvious, particularly from that final section of my update, some rules from now on are going to become more targeted as we move out of lockdown. And therefore, that means, unfortunately, that they also become a bit more complicated. If you are in any doubt at all about the changes I've just confirmed, and I've run through quite a lot of information there in a short space of time, please go to the Scottish Government website. Our route map sets out clearly what changes will apply and when they apply, and we are publishing an update today relevant to the announcements that I have just made. But although specific rules and guidance are changing, I want to end by stressing this, that a very basic principle still applies and actually becomes more important as these other rules change. It is only because so many of us have stuck to the rules so far that we're able to take these steps out of lockdown, and only if we continue to stick to the rules will we be able to drive the virus down further and live less restricted lives in the weeks and months ahead. For more businesses to reopen, for public services to get back to normal, for more of us to be able to meet indoors, for our children to go back to school full-time come August, all of these collective benefits depend on the decisions we make as individuals now and in the days and weeks to come. So please take advantage of the fact that some of these rules are changing. Get out and about a bit more if you can, and please support local businesses if you can as well. They need your support at this time. But always be aware, as we're seeing in Dumfries and Galloway right now, that this virus has not gone away. It is highly infectious, it is highly dangerous, and new cases are still being reported every day. So please at all times remember our key guidance, the facts. Face coverings should be worn in enclosed spaces. They are already mandatory in public transport and they will be mandatory in shops from next week. Avoid crowded areas, even if they are outdoors. Clean your hands regularly and thoroughly and clean any hard surfaces that you touch. 2 metres distancing remains the clear overall advice. Self-isolate and book a test immediately if you have symptoms of COVID. And those symptoms, let me remind you, are a new cough, a fever, or a loss of or change in your sense of taste or smell. You can book a test at nhsinform.scot or by phoning 0800 028 2816. And please don't wait to do that. As soon as you experience any of these symptoms, err on the side of caution and book a test. If we all follow this advice rigorously and stick to it to the letter, then we will stay safe, we will help to protect others, and we will save lives. So my thanks for your cooperation so far and for the cooperation I know you will continue to display in the days, weeks and months to come. Now, I'm going to firstly ask Professor Leitch just to say a few more words about the situation around Annan and Gretna, and then the Chief Medical Officer is going to say a word or two about children who are shielding, and then we'll take the questions that we have from journalists.
Thank you, First Minister. And just to add to some of the things the First Minister said, let me deal very quickly, first of all, with the potential Grampian outbreak and cluster that we discussed yesterday. You'll remember there were 2 contractors who had tested positive for antibody tests using a private company. We have now retested them using NHS antigen tests, and they are both negative. That cluster is closed down and complete. So there is no risk beyond the national risk around that area. However, the same cannot be said of the Dumfries and Galloway cluster. The incident management team met last night, as advertised, at 4 o'clock with the Directors of Public Health from Dumfries and Galloway and the Director of Public Health from Cumbria. in their local authority, with the contact tracing team, with the microbiologist, with everybody who you would expect to be on there, including the Chief Executive of Dumfries and Galloway Health Board. We had Scottish Government representation, including me, unusually, because this is a complex outbreak and the first one we've had in this removal of some steps in the route map. As the First Minister said, we have presently, and this could change even as we're speaking, we presently have 10 positive cases, and we have 3 high-risk workplaces involved in this cluster, and we want to be as upfront but as balanced as we can about that. The initial first case, and it may not be the index case, it's too early to say, but the first case that we were aware of is a healthcare worker from the Carlisle Hospital, and that may be connected to a nosocomial outbreak at that Carlisle Hospital, but we cannot be sure until we do genomic serology at a much slower rate. The other 2 high-risk workplaces that the First Minister touched on are 2 factories in Dumfries and Galloway, and we have sent mobile testing units to them today to test all of the workers in them. There will be another incident management team today at 4 o'clock, and they will continue to meet over the weekend. The Deputy First Minister chaired a Scottish resilience meeting this morning with local partners, at which I was also present to give them an update, again cross-border with the public health leads from Cumbria. That discussed the wider implications, and the partners were very supportive of the proportionate response that the First Minister has outlined following our advice. It underlines the rules. And this is really difficult, particularly on a day when we're discussing releasing some of the rules for children, and it's a hopeful day for many families who will be able to do more tomorrow, over the weekend and into next week. But most clusters of this size, when the history is written, suggest the guidelines may not have been strictly adhered to. I don't know that for sure in this cluster, but that is usually what happens. So I really implore you to obey the guidelines as best you can. If you follow them, your risk is lower. If you don't, your risk is higher. It's as simple as that. And you can see how quickly, within a matter of days, we can have 10 positives and an increasing number of contacts that gets harder and harder to trace. And already we have to take steps to make Dumfries and Galloway look a little different from the rest of the country, and we don't want to do that. The other thing, and finally, I wanted to suggest, is that if you don't follow the guidelines, you tie up resources. So in the last 3 days, we've used health protection teams, lots of contact tracers. There are 48 contact tracers in Dumfries and Galloway. The Chief Exec of a health board, who should be remobilising his health service, along with everybody else, Scottish Government resources, and our mobile testing units. I understand it is no one person's fault, and we don't want blame, and I don't want you looking for people to blame, but if you disobey the guidelines, that's what happens. We have to redirect resources in order to manage that outbreak. My final thought is, if you have symptoms, particularly, but not exclusively, if you are in this area of Dumfries and Galloway, please, please come forward for testing. We have multiple areas where you can now be tested in that area. We really want to get to the end of the virus transmission of this outbreak, and then we can advise the First Minister that Dumfries and Galloway can have the same restrictions as the rest of the country.
Thanks, Jason. And I'll lastly hand over to Chief Medical Officer before we take questions.
Thank you, First Minister. Today I want to provide you with an update about shielding. At the beginning of the pandemic, the 4 UK Chief Medical Officers published a list of 6 groups where people would be considered to be at extremely high risk of severe illness should they contract COVID-19. These groups were based on specific conditions, irrespective of age, and therefore included children and young people, all of whom were advised to shield to minimise their chance of catching the virus. For people who are shielding, we are especially aware that the restrictions in everyday life we have asked them to follow are extremely difficult. They impact significantly on their quality of life, and they increase social isolation. And for children and young people, these restrictions are particularly tough. This has been a very worrying and difficult time for those who are shielding, and I want to pay tribute to everyone for following the shielding guidance. We're now in the 4th month of the shielding period, and as new evidence and guidance becomes available, it's important that the approach is reviewed, and that only those who still require to shield are advised to do so. We recently announced changes to the advice for people who are shielding to say that we believe it is now appropriate for them to exercise outside, to meet with other households in a group of up to 8 people, and to take part in non-contact activities. And we'll continue to keep every aspect of our advice for people shielding under review. Findings from new evidence and research now allow us to reconsider and update the advice about which children are at the highest risk. The Royal College of Paediatrics and Child Health worked in partnership with a wide range of paediatric clinical expert groups to review new evidence and have produced updated guidance. This suggests that many children and young people currently advised to shield should no longer do so, as the risk is significantly less than originally assumed. Now, this new guidance, which is supported across the 4 nations, indicates that many children and young people with conditions such as asthma or diabetes, epilepsy and kidney disease may no longer need to continue to shield. This means that a lot of children will be able to enjoy what we all hope is a sunny and warm summer period. It also means that for some children they'll be able to return to school once schools start to reopen in August. However, it's important to stress that the guidance is just that, it's guidance. What it will allow is for clinicians to review individual cases, and where those clinicians who know their patient's clinical history best feel that the guidance applies, they can consider removal from the shielding list. But I want to stress that no child or young person will be removed from the shielding list until individual clinical conversations have taken place between the child or young person, the parents and carers, and the relevant clinician. It's only after those discussions have taken place and where it's been agreed that it's appropriate to do so that a letter will be issued to those affected to advise them that they no longer require to shield. I've written to clinicians today asking them to initiate the process of identification of those children and young people that may require a review of their shielding status based on the latest advice of the Royal College of Paediatric and Child Health. During the next few weeks, clinicians will start contacting children and young people and their families and carers where a discussion might be required. I want to stress that no action is required from patients or their families at this point in time. We'll also be writing to the families of children who are shielding in the next few days to advise them of these steps and what will happen next. To those children and young people affected by shielding, thank you once again for sticking with the guidance. And I hope that many of you received news from your clinicians during July that we can now begin to change this advice to you so that you can enjoy a much more fruitful and fun summer.
Thanks, Gregor. Thank you for being with us. I'm aware that these opening presentations today have been longer than normal, but as you will have heard, we have had lots of very important information to convey to you today, which of course is the principal purpose of these daily updates. We also have, understandably, a long list of journalists wanting to ask questions today, so we'll get on with that now. And the first question comes from Nick Sheridan from BBC Scotland.
Good afternoon, First Minister. The UK Transport Secretary this morning called on the Scottish Government to get on board with their plan for a list of countries which UK residents will be able to visit without quarantining on their arrival back into the UK so that he can get his list announced. Do you support the idea of a quarantine only applying upon return from high-risk countries? And if so, what exactly is the delay?
I've seen the comments from Grant Shapps this morning, and these comments seem to suggest that the Scottish Government is a block on these proposals going forward and the only barrier to these proposals going forward. And I want to say in the clearest possible terms that that is a misrepresentation of the situation. And I'm going to run you through why that is a misrepresentation of the situation. Firstly, we have sought to and continue to seek to come to an agreed position across all of the 4 nations, because I think everybody can look at the situation of air travel and think that that would be the ideal thing to do. But we all have a responsibility to make an assessment of proposals and come to a view based on our own circumstances. A 4 nations call took place yesterday evening, late afternoon yesterday evening. Hamza Yousaf participated in that for the Scottish Government. We went on to that call to discuss a proposal that had been circulated. Less than half an hour before that call took place, the UK Government significantly changed its proposal. And then it was only after that call that it provided the data for the change to the proposal to the Scottish Government And at the time it provided the data, it made further changes to its proposals. So to be blunt about it, we have a duty as the Scottish Government to assess proposals and come to a view on them. And we're finding it difficult to do that because they are changing in the way that I've just described. Secondly, as I said a moment ago, I wasn't on the call last night. Hamza Yousaf participated for the Scottish Government, but I do not think it is accurate. In fact, I am certain it is not accurate, although I don't speak for other governments, to say that it was only the Scottish Government that had questions about the timing and or the content of these proposals. Thirdly, the Chief Medical Officers, I know, have discussed this issue earlier today, and I'm going to allow Gregor to give you information out of that discussion. But the final point I would make is this, and I'll just say this straight. I think the UK Government should spend less time trying to misrepresent and politicise these difficult issues that we are dealing with right now. Less time trying to pick pointless fights so that all of us can just focus on the task at hand. And let's remember what that task at hand is. It is trying to steer the whole of the UK and our respective nations within that through this crisis as quickly as possible, but as safely as possible, so that lives are not needlessly lost. I remain committed to getting on with that task in as collaborative and constructive a manner as possible with the UK Government, the Welsh Government and the Northern Irish Government, and I hope we can move forward on that basis. But some of these interventions, such as the one from Grant Shapps today, frankly, is not helpful in that regard. Gregor, do you want to say anything about the Chief Medical Officers?
Thank you, First Minister. So I think, as you would expect, I've been involved very closely in discussions right from the beginning as to how we approach this very complex issue. This morning, the 4 UK CMOs took part in one of our regular calls where this formed a major part of the discussion. And we discussed, as well as the prevailing epidemiology of each of our 4 nations, the approach to identify those countries who may have travellers coming to the United Kingdom and how we assess the risk that's associated with those travellers. We collectively agreed that further work was still necessary to order that we have the criteria properly and most robustly applied to how we assess that risk from those travellers. And there's further urgent work which will now be taken forward to make sure that we have the ability to be able to assess those that degree of risk as fully as possible.
Cree from STV.
Thank you. You've said many times throughout this whole process that you've been pleased with the way people have followed the rules. But on face coverings in shops, clearly not enough people have responded when you've asked them to do that. So now you're having to tell them. Has that disappointed you? And can I ask Jason Leitch if there is a concern that if people are wearing face coverings in shops, particularly supermarkets, it might cause people to forget about the social distancing there, which seems to be treated pretty casually in some cases already?
Well, that last point is important. I'll hand over to Jason on it. But face coverings is one thing we can do to reduce risk. It's not a substitute for the other things, and we've been very clear on that. I'm not disappointed. Look, I don't want to sound like, somebody who's standing here giving people lectures. We all want to do the right things, but some of these things are really difficult. I think face coverings is probably one of the things that causes people most discomfort because it's not particularly pleasant to do, although from my own experience you do get used to it once you start doing it a bit more often. But we have proceeded for a period with a voluntary approach to this. Some people are complying with that, some people are not, and I'm not pointing fingers or trying to blame people for that. But we have to make a judgment, particularly if we're going into a period where, firstly, more people are interacting. Secondly, as I set out today, we will be having discussions with sectors like retail about the ability to reduce 2 metres to 1 metre, which also increases the importance of face coverings as a mitigation. And lastly, in settings like shops, similar to public transport, where we don't always know the people we're in contact with, because so that makes contact tracing more difficult. So these are the reasons that we've brought to bear on this decision and the reason we've arrived at the decision that I've confirmed today.
The First Minister's summary at the beginning was correct. It doesn't replace anything, but nor does physical distancing replace the face covering. None of these elements are singly helpful. They have to be used as a package. That's why facts has been our way of remembering that. I do see increased numbers of face coverings, and that's encouraging. I see it as I'm out and about. People are getting more fashionable ones. I'm not sure I'll do that, but it's certainly becoming more culturally normal to wear a face covering. I think that's a good thing for dealing with this pandemic. Face coverings will not stop you being contact traced. They will not limit you having to distance. They will not limit you having to wash your hands, but nor will those things stop you having to wear a face covering. So it's important that we think of the whole package of protection.
Thanks. Peter McMahon from ITV Border.
Thank you very much, First Minister. If I could go back to the cross-border cluster, if I can ask you, if the 5-mile driving travel limit has not been lifted for obviously very good reasons, is this effectively the Gretna area being in some kind of lockdown? And what is your message to people there about complying with this and how it should be enforced? If I could also ask Professor Leitch on just a couple of the, important issues, they're not necessarily technical issues. The first one is, for those of us who are not medical experts, the outbreak in Carlisle, a nosocomial outbreak, if you could explain what that is and the significance of this. And secondly, as obviously this is a cross-border initiative, will some of the things like testing and restrictions on travelling apply as far as, south of the border? Because if you're going from an area from Gretna to Langham, well, somewhere like Longtown, which is in England technically, is actually closer to Gretna. So how is that being applied? And if people are seeing mobile testing units turn up in a couple of factories in and around Gretna, should they not be, and might they not be a bit worried when they see that? That's a lot of questions, but thanks for that.
Okay, I'll answer the one to me, and then I'll hand over to Jason for the more technical questions. No, I'm not describing Gretna or the Annan or Dumfries or the other areas we've talked about today as being back in a lockdown that is stricter than the other parts of the country. I don't think that would be accurate. What we are applying today is a very proportionate and targeted intervention to try to manage a risk. And don't underestimate the factor here that comes from the coincidence of the timing of this outbreak and the fact that we are due to lift the travel restriction tomorrow. So if the travel restriction for Scotland had been lifted 2 weeks ago, there might have been a different judgment about whether we would have had to reapply it in these areas. But it doesn't feel right now to be lifting it while we have this outbreak underway. So these are fine judgments, and what we have sought to do today is come to a proportionate set of decisions that doesn't overreact to this, because I'll repeat what I said earlier on, there is nothing to suggest at this stage that the test and protect contact tracing approach is not working to contain this outbreak, but it's an obvious statement of fact. Until we've concluded that exercise, we can't be sure about that. So this is precautionary. This is, as Jason said earlier on, this is the first of these outbreaks we've had since we've started to lift lockdown. So we're probably going to be a bit more precautionary about it than we may be, although we'll still be precautionary, but the nature of what we do on that precautionary basis may be slightly different now to what it will be weeks or months down the road when we've got a bit more experience of dealing with this. So I know this is inconvenient for people in the area, but it's for your safety, and it's just acting in that precautionary but proportionate way. And we'll give another update on Monday when this management process around this outbreak is completed, and if at that point we are confident that the outbreak is being contained, then we'll be able to move into a different position. So it's a few more days of some restrictions, but I think that is worth it to try to stop what hopefully will be a relatively small outbreak becoming much bigger and perhaps spreading to other parts of the country. And on the factories, which Jason will say more about, this is a precautionary measure as well to make sure we're testing in these workplaces to give assurance. At this stage, there is no need to be concerned that we think there are outbreaks in these workplaces. We're doing everything at the moment on an ultra precautionary basis, which I think is the right way to proceed given the stage of all of this that we are currently at.
Peter, your questions illustrate the fact that we think this outbreak is complex. It's not a binary, complex, simple outbreak, but our advice to the First Minister and the Cabinet Secretary for Health were there were enough elements in this outbreak that something special needed to happen, and that was the judgment that the First Minister and her colleagues made. The nosocomial outbreak, forgive me for the technical language, it's just a simple way of suggesting that in institutions, patients give infections to staff or staff give infections to patients. You've seen that happen in Scotland. Nosocomial outbreaks are an inevitable consequence of a new virus, and we've had some of them, and Carlisle will have some of them, as will the rest of England. And that may be where this virus, this particular cluster, originated. The cooperation between Cumbria and Dumfries and Galloway at a public health level is excellent. I've been very impressed with their Director of Public Health and our Director of Public Health. They will do what they need to do in England. My understanding presently is there are no positive cases out with the hospital that are concerning them related to this. The ones we are concerned about are the ones who live in Dumfries and Galloway, some of whom work in England. And just to follow up and reinforce what the First Minister said, if you see testing units, you should be reassured. You should not be worried. You should embrace that opportunity to get tested. We do not think there are outbreaks in these factories. Otherwise, we would be doing something different. We want, as a precautionary measure, particularly because we have the testing capacity and we have it available to move, we want to test so that these people can be completely reassured that the viral chain of transmission, which is what we're trying to get to the end of, is managed appropriately.
Thanks, Jason. Glenn Campbell from BBC.
First Minister, would it help your test and trace system to name the businesses in Dumfries and Galloway where you're planning to do the testing? And on a completely different topic for Jason Leitch, my colleagues in sport wonder if there's any more clarity that you can give on the return of fans to football, with one club apparently marketing its season tickets on the basis of 7,000 fans being allowed back.
On the factories concerned, I think there is public media conversation about that, but I'll hand, Jason took part in the IMT last night, so I'll hand over to Jason to say a bit more about that.
So my understanding is that the Young's Food Factory in Dumfries and Galloway have already put out a press release which is reassuring, and appropriately reassuring, both to their workers and to the general public, exactly as we've said, that the outbreak is not in the factory. That would be much more worrying. We're slightly cautious about that public messaging because you've seen internationally that food processing areas are good for this virus, but we have no reason to believe, knowing a little bit more about that contact and that positive case, to worry about that factory. The other factory is Alpha Solway, who make PPE for us and for the rest of the UK. Again, please take this in the proportionate manner it's meant. We have no reason to believe there is community transmission or factory transmission of this virus in either of these workplaces, but we are going to test them. We've also asked our Public Health Director in Dumfries and Galloway to have conversations with the managers around mitigation, around perspex screens, around all the things they already have in place. And on the IMT yesterday, the report that came back, for me, I haven't been to these factories, but the report that came back to me was very reassuring about exactly what is already in place. Lots of spacing, good ventilation, all the things we've been talking about around the physical distancing. As for sport, my answer is the same as yesterday. I simply cannot predict when crowds will be back. I can predict that it will not be soon, it will be phased. I had another conversation yesterday with the leadership of the SFA and the SPFL, the club leadership, along with some colleagues, and I have suggested in media in the last 2 or 3 days, perhaps October. I would maybe pencil it into your calendar, but I certainly wouldn't write over it in pen.
Can I just reiterate the point about the workplaces and the action that has been taken being precautionary? And I think that's an important point to stress for those who work in these companies, but also those who will have relatives or friends who work in them, or people who live in the surrounding areas. And while we're not at the end of the management of this outbreak yet, so we can't be certain that there has been no onward transmission, what people are seeing here in the operation of Test and Protect should give assurance, because these are the things we want to make sure happen when we face a situation like this. And an incident management team taking decisions, which you will have heard me say in context previously, that are driven by public health, and that includes naming companies or other settings if that is helpful as part of the public health response, and we should take some confidence in the strength of that public health response, although of course we are still in the early stages of this pandemic. Phil McDonald from Global.
Thanks, First Minister. Just to follow up on what Peter was asking about the local outbreak in Dumfries and Galloway, you've asked people not to travel to pubs south of the border. That was in your opening remarks. And I was just wondering, are there any specific plans to enforce that, such as putting more police in the area? And secondly, does that advice only apply to people living in Dumfries and Galloway, or would people in, for example, towns in the borders be allowed to cross into England to go to pubs and other landmarks?
So, in terms of the enforcement, this is guidance. The travel limit has been guidance, not law, for the past number of weeks. But we are strongly recommending that people stick to that guidance, and of course it will be always for the police to determine how they enforce these situations where there is regulation in law, but also wider issues in an operational sense. Can I stress, I tried to make this clear in my opening remarks, but I appreciate it's a lot of information to absorb initially, but can I stress that this does not apply to the whole of Dumfries and Galloway. We have been clear about the areas, Gretna and Annan, Dumfries, Canonbay, Lockerbie and Langham are the areas that this applies to. We will publish later on, I'm just checking, I think Jason might have them here, the particular postcodes, which in a moment I'll ask Jason to read out. So we're trying to be as targeted and as restrictive as possible. As you've heard me say many times before, we want to come out of lockdown sustainably. We don't want to go back into lockdown nationally, and we don't want to go into lockdowns locally if we can avoid it. And this is not a local lockdown. If we can get this virus to the lowest possible levels, such as we have been doing and which has happened in Dumfries and Galloway, when we have these outbreaks, it enables us to tackle them and try to contain them in a more targeted way. And that fundamentally is why we all have to keep sticking to this advice, so that we hopefully avoid outbreaks like this, but when we have them, we can have a laser-like approach to them. Jason, do you want to give the postcodes?
Yeah, so for absolute clarity, if you are resident in one of these postcodes and or you have self-catering booked in one of these postcodes, then we ask you not to travel more than 5 miles, and very unfortunately, you cannot visit a care home in these postcodes yet. DG16, which is Gretna, only the Scottish section of DG16. We have no control over the guidelines in the English bit of DG16. DG12, which is Annan, DG1 and 2, which is Dumfries, DG11, which is Lockerbie, DG13, which is Langham, and DG14, which is Canonbay.
We will put that information on social media this afternoon so that people are fully aware of it. Lindsay Hannah from Bauer.
Thanks, First Minister. Radio Clyde has been hearing from the owner of NAF Nail Salon in Glasgow today about her frustrations around reopening. She's told me that she feels that they have many hygiene
to open or have clarity about when they will open. We will give that clarity as soon as possible, and these things are under ongoing review. I'll hand over to one of my clinical colleagues here in a moment. But in very simplistic terms, because people have asked me what's the difference between a hairdresser and somebody in a beauty salon. One of the things is the degree of face-to-face contact, where a hairdresser will not always, but perhaps more often be standing behind you, whereas somebody doing your nails will be face-to-face with you. Now, there are ways in which all of that, I'm sure, can be mitigated, but we have to make sure we work through all of that carefully, and that's the process we're going through. But we want to get all and every business open and trading viably as quickly as possible. But I hope people appreciate that we have to take care. We know that this virus does real harm when it is allowed to. I think over the past couple of weeks, we've maybe all been thinking that, or forgetting that, because the numbers have been getting better. This outbreak in Dumfries and Galloway should bring it right back to the forefront of our minds. If we take our eye off the ball, if we drop our guard, if we take risks that are unacceptably high, then we will not just be dealing with outbreaks in somewhere like Dumfries and Galloway, we could be quickly dealing with sustained community transmission again. So all of these decisions are being taken with the best intentions in mind and for the best health reasons. Gregor, do you want to say more about the differences in places that maybe sound very similar?
So there's none of these judgments are very easy to take at all. And we've got to take so much into consideration as we're applying the degree of risk that we associated with these different environments. And it is very much about the whole environment that we consider in this time. What we've spoken about in the past, of course, is that actually even the physical distancing guidance very much relates to the way that you're orientated two people together. So face-to-face risk is at its greatest, but side-to-side risk or even somebody, if they're behind you, has a different degree of risk associated with it as well, as does how long you spend with that person, what surfaces are around about you, and the degree of physical contact that you might have during that time as well. So all these things are taken together when we try to judge the degree of risk associated with these different scenarios. Now, at this moment in time, the judgment that we've made, and I think it's absolutely the correct judgment, is that whilst we can take forward the reopening of hairdressers and those type of personal services, other types of personal services, such as some of the beauty therapies that people would undertake, or personal services such as receiving a tattoo, are going to have to wait just that little bit longer till we're more sure that the risk has completely dissipated and that it's safe to do so.
Thanks, Gregor. Tom Eden from PA.
Thank you, First Minister. Good afternoon. As part of the mitigation measures you set out for hospitality, you confirmed that pubs and restaurants will need to collect people's details to support test and trace. Can you give some more details about how this will work in practice? What can pubs and restaurants do with this data and how it will comply with GDPR? And just in light of the news of Kirsty Blackman stepping down as Deputy Leader of the SNP at Westminster, citing lockdown, the impact of lockdown on our mental health, can you sort of say what your message is to others who may be struggling, and how are you doing personally?
Thank you. Firstly, sorry, I wasn't pausing before I answered that question. There, I was trying to remind myself of your different questions by writing them down. Look, this is. The priority for me is to think about how other people are doing. I'm doing fine. I'm very busy, get a bit tired sometimes, not just answering all of these questions, but generally. But I've got a job to do, and I'm getting on with doing it to the best of my ability and trying to keep focused on that. Kirsty Blackman, for those watching, Kirsty is an MP in the House of Commons. She has been the Deputy Leader of the SNP Westminster group there, and she announced yesterday that she was standing down from that role to focus on her constituency and family, and very bravely, and I think it is to her immense credit, was very open about the pressures on her mental health that she had experienced during lockdown, and that was the reason behind her decision. So I would pay tribute to her. She's a fantastic, talented politician, but I think it's really good that politicians do speak out about the trials and tribulations that we all have. I know sometimes it's difficult for people to accept, but we are all human beings suffering from the same stresses and strains as others. And I think it's important at this time that people understand that this is difficult for everybody, and cut yourself some slack. Don't be hard on yourself. There are sources of support out there if you need them through NHS 24 and other organisations. Make use of those sources of support, and remember that while we're all experiencing this differently, because we all live in different circumstances, we're all going through this thing together at the same time, and we will get through it, and the support that people need will be there as we go. And hopefully, as we start to ease more of this, then some of that pressure on people lessens, although I'm very mindful that that pressure right now for many will be getting replaced by worries about jobs and the economy and living standards, which is why increasingly our focus is on that as well. On the question about the customer details that pubs and restaurants will be asked to take, we will be having discussions with the sector about how exactly that would happen. I would hope the sector itself will put ideas forward about how they can do that effectively and efficiently. I would hope that in time, it may not all happen immediately. There might be some electronic ways in doing that. We see that in other countries with QR codes, for example. But we will discuss that, and we will make sure that as we go through this process over the next few days ahead of hopefully going into phase 3, issues around GDPR and any legal requirements are properly thought through and set out in guidance. Conor Matchett from The Scotsman.
Thank you, First Minister, and glad to hear that you're doing all right mentally. I just wanted to touch slightly on the 2-metre rule and scientific basis for that decision. I wondered, is it actually any different from the decision made by Boris Johnson a few weeks ago to have a 1-metre plus rule? And if not, would you say that Boris Johnson is putting Scots at risk by reducing the 2-metre rule to a 1-metre plus rule?
Look, you've heard me say this lots of times. I'm not here to criticise. I'll kick back a little bit when my government has been unfairly criticised, which I think it has been today, which is why you heard me do that earlier on. But I will not go out of my way to proactively criticise other leaders. We're all grappling with and wrestling with the same dilemmas right now, and none of them are easy. And we're all perhaps coming to slightly different judgments, although in the main, I guess we will come to broadly the same judgments, albeit on different timescales. I think it's for Boris Johnson to set out and explain and, where necessary, justify the decisions he is taking. Where I am taking a different decision, then whether you agree with that or not, then I hope you will take my assurance that I'm doing it for good reasons, because my judgment is that we need a different decision, or perhaps the same decision but on a slower timescale in Scotland. And I will stand here every day and set out my reasons for that and answer questions about that. There is a tendency on the part of some, not you, Conor, but on the part of some, to assume that whenever I decline to just go along with a decision that somebody else has taken, even when I don't always know the basis of that decision, then I'm in the wrong. Now, sometimes that will be true. I am not infallible by any stretch of the imagination. But actually, and I'm not complacent about this, I hope I've convinced you that I'm not complacent about any of this, but when you look at the map of the UK right now and the infection levels in Scotland, which are probably lower than in many other parts of the UK, then maybe that suggests we're not getting it all wrong at the moment. We will make mistakes and we will have challenges, as we're dealing with in Dumfries and Galloway right now. But our careful and steady approach right now is working, and I think we should stick with that, because it might mean that it's 2 weeks later for pubs to open in Scotland than in other parts of the UK, but if it gives us more chance of making sure we're not having to shut them again in parts of the country in a few weeks' time, then I think that is worth it. So I'll continue to try to judge these things on the basis of the best evidence and the best judgment I can apply. And if I get them wrong at times, I will say that and I will demonstrate how we're trying to learn from that. Michael Blackley from the Daily Mail.
Hello, good afternoon. A lot of families just now at the start of the school holidays will be thinking about flying out to some of the holiday destinations where flights are available. So can you tell them how far away you are from an agreement on quarantine-free travel? And can you also, how much of a factor is the timing of this? Obviously, the Scottish tourism market doesn't fully get up and running until 15th of July, which is later than England's. Is that one of the key factors in your concerns over this, or is it wider ranging than that?
Well, most families who contact me, and with parents who contact me, and I accept that will be a minority of the total population of parents and families in Scotland, I'm sure some of them would love to get away for a holiday to foreign climes over the summer, but actually most who contact me, their main priority is to know that whatever decisions we are taking and whatever they are being advised to do or not to do is prioritising their safety and the safety of their children. So that, I think, is the driving priority for most people, and that is the driving priority for the Scottish Government. How far away are we from a decision? As the Chief Medical Officer has said, that the 4 CMOs have decided there is, or have given the view that there is further work to be done, and there are balanced judgments that have to be made here. There are some countries where prevalence of the virus is probably lower even than it is in Scotland. There are other countries where it will be higher or maybe increasing slightly. So if we allowed air bridges from those kind of countries, more medium or higher risk countries, then we'd be taking the risk of bringing the infection back in. This is just about trying to keep us as safe as possible from a virus, and we will continue these discussions as constructively as possible. But it would help if the proposal the UK Government wants to get our agreement to didn't keep changing. As I said earlier on, yesterday, half an hour before a meeting to discuss the previous proposal actually started. So let's have some constructive cooperation on all sides here and see what progress we can make. For us, timing, of course, we've got different timings for openings of our tourist sector, but the timings for that are driven by our assessment of risk. And therefore, if we are deciding that the tourist industry can only safely reopen from the 15th of July, then clearly that has a read across into our assessment of risk in other areas. And these things all have to be taken into account. At the end of the day here, this should only be about what we need to do not to eradicate risk, because unfortunately we can't eradicate risk around this virus, but to minimise it as much as possible and not to take needless risks that we believe might lead to a resurgence of it in the near future. So I will continue to try to reach a Four Nations view on these things. But fundamentally, my responsibility is to reach a view that is right for Scotland. And if that can be aligned with the other Four Nations, great. But fundamentally, my job is to try to get it right for Scotland, and that's what I'm going to continue to try to do every day. Muir Dickey from the FT.
Thank you. Just to follow up on that point, and looking at the very big picture of the Air Bridges idea, do you think that having relatively open access to lots of countries is compatible with your goal of getting as close as possible to eliminating the virus in Scotland?
It's compatible if we make it compatible, but it does mean, Scotland is not the only country trying to drive levels of this infection as low as possible. I think, I look at, and I certainly can't speak for Ireland, but, I know that there are debates in Ireland around air bridges as well. There are many countries being very thoughtful about these decisions. So I want to open travel as quickly and as comprehensively as possible, but I want to make sure that in doing that, we just don't take too many or too high a risk around the virus. I mean, it's not, and I keep prefacing this is not a complaint or a criticism, this is in the nature of scrutiny, so I totally accept it. But if we cast our minds back just a few weeks, the kind of questions I was getting here every day were, shouldn't we have gone into lockdown sooner? And secondly, shouldn't we have stopped international travel sooner? Now, I'll defend the decisions we took, and where I think we got them wrong, I'll be open about that. I certainly took the decisions, and the Scottish Government did, based on what we thought was right at the time. But if there were people who were prepared to make that argument a few weeks ago that we didn't restrict air travel early enough, then doesn't that mean that we should take care about it now before we go in the opposite direction? This is not about trying to stop things. Before this crisis, I was probably the biggest enthusiast of any politician in the UK for people coming to our country, both to visit and to holiday, but also to live and to work. I'm an internationalist. I want people to travel freely between different countries, but I want to get this virus under control and keep it there, because I don't want to be standing here for too much longer having to report to you on people dying from it. So that's why I will continue to be careful and cautious about this, and try to align that careful, cautious approach with an objective to eliminate as far as we can this virus, with opening up our economy and opening up our country as safely as possible. But I won't be dragged along in decisions either that I don't understand or fundamentally think are putting the people I serve at higher risk than is necessary. Tom Peterkin from the P&J.
Good afternoon, First Minister. You've said that 2 metres remains the benchmark as far as social distancing is concerned. I'm wondering if you can confirm that island ferries will be an exception to that. We know CALMAC have said that the current 2 metre requirement means they can only operate at 17% passenger capacity. So I'm wondering that even if we do see it reduced to 1 metre on island ferries, is that going to be enough for island economies?
Again, I know I covered a lot of ground in my statement, but I did say in my opening statement that the sectors we would initially work with were hospitality, retail and public transport, and it would include ferries in public transport. So yes, that will be one of the sectors that we're having these discussions with. Look, all of us would prefer that we weren't living in a situation just now that required any undue physical distancing. We'd all prefer just to go about our lives completely as normal and keep whatever distance we wanted to from individuals, depending on how much we liked them or otherwise. But that's not the situation we live in right now. And so we have to balance the absolutely vital and entirely legitimate and understandable economic imperatives with the public health imperative. And the balance we strike is not ideal, but dealing with a pandemic is not ideal. So we will continue to try to strike the right balance that allows companies or ferry operators to trade viably, because that's important to all of us. Jobs depend on that. But lives depend on not taking risks that will allow the virus to spread out of control. So that is not an easy balance to strike, but it is the balance we have a duty to try to strike as best as we can. Tom Martin from the Daily Express.
Hi, thank you. Just on mandatory face coverings in shops, last week you indicated that it was likely to fall, in terms of enforcement, was likely to follow the model on public transport. So could I just confirm that it would be backed up by fines and how it will be policed? And what kind of advice would you be giving to shops and how they deal with people who are not wearing face coverings?
We'll publish the regulations shortly. As I said, this will come into force on the 10th of July, which, if my memory is serving me correctly, my calculations are serving me correctly, is a week on Friday. And the regulations that will put that into law will be published then. It is likely to follow very closely the situation on public transport. So in terms of enforcement, that would involve, for people not complying, potentially the imposition of a fixed penalty notice, which, again, if memory serves me correctly, starts at £60, but can go up if there is continued breaches. It's not something I think it is fair or reasonable to expect workers in shops to enforce. So police would be able in certain circumstances to impose fixed penalty notices, but the police will enforce these things very proportionately and sensitively. And I recognise very readily that this is not the easiest thing for the police to enforce either, which is why all of us can help by doing this voluntarily, even although it is going to be backed up by law, and doing it because it can make a difference along with all of the other things we're advising you to do in keeping the virus suppressed. So we're doing it for our own good and for the good of people we love and people we might come across in a shop, even if we don't know them. So it's that collective thing that we should be driven by here. But it's important, I think, given how vital we think it is in the wider scheme of things, to have that backstop of enforcement if necessary. Vivian Aitken from The Record.
Good afternoon, First Minister. I want to ask us about PPE in hospitals today, if I may. Nurses continue to tell me how the PPE they believe is not safe or appropriate. And they say they're faced to use FPP2 masks to carry out testing. Now, these masks, if people don't know, are the ones that many of us use on public transport or in shops to protect other people. And the staff say that they do not actually protect the wearer. The FFP3 masks, which are sealed, are not being used because taking swabs is not seen to be an aerosol generating procedure, yet they often produce a cough, which is an aerosol in itself. Nurses are worried that they're not satisfied with the claims that these are safe because other PPE items they were told were safe, out-of-date masks, tiger goggles, have now been withdrawn because they are not considered to be safe after all. So when will nurses' concerns be listened to seriously, and can you assure them that the masks they are currently given give 100% protection against pathogens?
Nurses and other healthcare workers' concerns are always listened to seriously, and one of the things we did early on in this pandemic was to establish a helpline, a hotline, so that an email address rather than a line, to allow frontline workers to raise any concerns that they have. There is guidance on what PPE is used in what circumstances. That is guidance that politicians haven't drawn up. It's been drawn up by the four countries with expert input to that, and that is right and proper. I'm going to hand over. I think both Gregor and Jason want to say something here, but can I just finally say we're not asking people in shops and public transport to wear face masks that people in hospitals would wear. We're asking you to wear face coverings, which is any piece of cloth that can cover your nose and mouth. Gregor.
So I think that's the first important point, is that the guidance which exists around about the wearing of PPE in healthcare scenarios is something which has been developed from a very robust evidence base over time, and it's constantly reviewed over the course of this pandemic as well. So the advice is received from groups such as NERTAG, for instance, as to which types of procedures in a healthcare setting may be aerosol generating or not. And the taking of a test is not thought to be aerosol generating at all. And then that's used in a way by infection prevention and control experts to develop the guidance around about which circumstances and scenarios it's most appropriate to wear which types of PPE. And we should be very proud of the approach I think that we've taken in the UK in relation to determining that. It's using a strong evidence base, but it's also using very well equipped clinical experts to assess the risk in those different scenarios so that the right PPE can be recommended at all times for staff, and staff should have confidence in the robustness of that advice that's been given.
Okay, thanks, Gregor. Jason, do you want to briefly add?
Only to add a slightly techie point, and that is FFP2 masks are the WHO recommended masks for COVID in intensive care units. FFP3 masks are an extra level of protection. FFP2 masks are not what we're telling the public to wear, and the public are not wearing them. They are the white ones, often with a little filter on the front, that are very well fitted around your face. Nothing to do with recreation or face coverings.
Thanks. Christine Lavelle from The Sun.
Thank you, First Minister. The Commission on School Reform think tank has suggested today extending the school day to help pupils catch up on lessons lost. I just wondered if this was something the Scottish Government was considering. And just on Tom's question on face coverings and fines for those who don't comply, if, for instance, a 6-year-old child won't wear a face covering in a shop, would you expect parents to be fined?
Look, the police in enforcing any of these things will be proportionate and sensitive, and the kind of situation you've described there would, I'm sure, be dealt with in that way. So let's encourage people to do it for the right reasons, and then the exceptions to that can be dealt with appropriately. On the first part of your question, I'm sorry, I've not had time this morning to read the proposal that you refer to, so I don't exactly know what it says, but I'm happy once we've had a chance to do that to give you a more detailed answer. Simon Johnson from The Telegraph.
Good afternoon, First Minister. I just wanted to return to Grant Shapps' comments this morning. Was it ever your understanding that the UK government ever say to you that if you didn't agree to this, that it would somehow scupper the air bridges thing for the entire UK? You decide to do something different on this after studying the new proposals. Are you confident that the UK Border Force will help you have a quarantine system perhaps in Scotland only?
I'm not sure I entirely understand the first part of your question, but maybe I could answer it in this way, that if you want to reach a Four Nations agreement on something, and this is, again, to be blunt, something that the UK government seems to struggle to understand. If you want to reach a Four Nations agreement, then you have to have each of the Four Nations prepared to agree. And that involves proper discussion, listening to each other's point of view, compromising, no doubt, but coming to an agreement. And if you're going to take a view that if one nation, and I remember what I said earlier on, I don't think it is accurate to say that it was only the Scottish Government raising questions about timing or content of this yesterday, but hypothetically, if you're going to take the view that where one nation, for whatever reasons, doesn't feel it can agree to something, then they are scuppering it for the rest of the UK, well, that doesn't really sound to me like appropriate or sensible Four Nations discussion. So the UK government should maybe just stop trying to pick needless fights here and actually commit to Four Nations discussions in the proper way, which involves listening to us. I can't force them to agree with things that I want to do, but equally they can't force me. So where we come to a view where it's not possible to have a Four Nations agreement, we respect each other's different positions. And if we get into that position, which I don't know that we will, and I don't want to get into that position, but if we get into that position on air bridges, then we'll deal with the practical issues that arise at that point. But if we want to get Four Nations agreement, then come at it in a proper spirit and in a proper way, and share all of the information and the proposals in good time, and listen to each other respectfully, and that will increase the chances of us getting where we want to be. Andrew Learmonth from The National.
Sorry, can I just press you on the Border Force point, whether you've had any discussions about whether Border Force could do a sort of quarantine system?
We will discuss if we end up in a different position here, we will have discussions about the practical implications of that as we go along. These are regulations that are in place in Scotland, and therefore these practical issues have had to be discussed so far. But let's not get ahead of ourselves, and let's not always assume. This is a vain comment to the Daily Telegraph, I accept, but let's not always assume when there are these differences of opinion, the UK government is always right and the Scottish government is always wrong. There will be some cases where that is the case, but there will be other cases where it is not. Andrew Learmonth from The National.
Thanks, First Minister. You may have seen a number of musicians and bands, including Scots like Emily Sandy and Twilight Sad, Simple Minds, have signed an open letter to Oliver Dowden in a bid to asking him to prevent catastrophic damage to the music industry. Some of their asks are devolved, including a clear conditional timeline for reopening venues. Given that today we've had football with crowds penciled in for October, when do you think we might be able to head back to the Barras or the Hug and Pipe?
Firstly, I hesitate because I don't think I am contradicting him, but I'm just going to clarify. Football with crowds has not been penciled in for October. We haven't taken that decision yet. Jason was simply trying to find a way of saying, don't assume that it will be October that you get crowds back. So do not take from this that we have given football an October provisional date for crowds being back. That is not the case. And actually, I don't think it's a fair interpretation of what Jason actually said. I've got huge sympathy for the position that musicians and venues find themselves in, and the position of the arts generally. Fiona Hislop and I made some comments about this last week about the fundamental importance of arts and culture, not just to our economy, but to our well-being as a country and our sense of who we are as a nation. So we want to make sure, and we will respond to the open letter once we've had a proper chance to consider the requests of the Scottish Government. We'll respond to that fully, and we will also support musicians and venues in the requests, assuming we think they're reasonable, which I'm sure they are, to the UK Government as part of our discussions with them. On the issue of dates for opening of venues, we will give provisional dates as quickly as possible, but I come back to the point I've made all along. We have to do this safely, and that means we have to consider all of the relevant information before we get to these positions. But I want to see venues, just as I want to see beauty parlours and other parts of the economy open and thriving again just as quickly as possible. David Ball from the Herald.
Well, thank you, First Minister. If the science hasn't largely changed on the 2-metre rule, how concerned are you that relaxing that rule, even with the mitigation, could contribute to a second spike, given the outbreak in Dumfries and Galloway has illustrated how sort of fragile the situation can be? And also, a survey by the NAS UWT Teaching Union has found that only 22% of teachers feel safe returning in August. What can you say to teachers to sort of reassure them?
Well, in terms of that part of the question, we have a number of weeks between now and August the 11th when we hope schools will be back full time, and there'll be a lot of work done to assess the prevalence of the virus to make sure it's still low enough to support that full time return that we want to see, but also that we have had proper discussions and done proper work with teachers, parents, councils to make sure that the package of measures in schools is sufficient to ensure that children and teachers are safe. I've been very clear all along that teachers' safety here and their confidence in their own safety matters. Teachers are teachers, obviously, but teachers are also parents. They have families of their own, and they want to be sure that they're not being exposed themselves to unnecessary risk or taking that risk back to their own families. So we take that very seriously, and the Deputy First Minister will continue to lead that work. On the question about 2 metres distance, you know, there's risks in everything we do right now, and as the advisory group said, the science hasn't changed, that it is a statement of the obvious that as you come closer to another person, your risk of transmitting a virus to them or getting it from them increases. But that risk can be mitigated, and therefore it is a value judgment, a policy judgment about the tolerances that we are prepared to accept. So I think we can do this in certain settings, but only if the appropriate mitigations are agreed and implemented. And if businesses who want to operate at less than 2 metres are absolutely assiduous in the implementation of these mitigations, and that is the requirement of allowing the exemptions that we've talked about today. And lastly, I do think as we go further down the path of coming out of lockdown, more of us, compared to when we were all just being told to stay at home, we have to exercise much more individual judgment and responsibility. But to do that, we have to have information. The Scottish Government is going to be producing much more detailed surveillance information that allows people to know the risk or our assessment of the risk of the virus in their own areas. That will develop over the next few weeks. And equally, if you are going somewhere and that business has decided to operate 1 metre with mitigations rather than 2 metres, you have a right to know that before you go in, so that you can assess whether you want to do it or not. And that's why information to the public, I think, is an important part of this. We are now going into a situation, Jason made this point earlier on, where we're not relying on the blunt instrument of stay at home to control this virus. We're relying on all of us doing a basket of things. And if we all do that basket of things responsibly, we can continue to keep it at the levels we need to keep it at. But if we don't, if some of us stop doing some of these things or take too many risks, we'll end up with multiple Dumfries and Galloways, and that's what we have to avoid. And the last question today comes from Kieran Andrews from The Times.
Thanks, First Minister. Can I just check on the relaxing of restrictions for under 11s in terms of physical distancing? Does this mean that they will not have to distance from adults? You know, can any child under the age of 11 give their granny or granddad a hug now? Or does it just mean they're free to play with their own friends and need to maintain that distance from older people?
The physical distance from children under 11 has been relaxed. Adults between adults need to continue to physically distance, but I'll ask the Chief Medical Officer to confirm that.
Yeah, this is something we've looked at very, very closely, just to try and assess the degree of risk that is associated with particularly younger children, as you've described. And we know from the evidence that we've looked at across our experience of the pandemic so far that there is much less likelihood and much less risk associated with transmission in those circumstances. And what we'll do is that we'll provide full guidance alongside this over the next few days, just to make sure that everyone is clear as to the circumstances that they can come together like this. But it's mainly about making sure that these children can actually have some sort of play together now.
Yeah, thank you. Sorry, maybe I wasn't clear in my question, but do under 11s need to physically distance from adults?
The physical distancing has been relaxed for children, between children and adults for under 11s. Can I draw this to a conclusion, because that is all the questions. If you have stayed with us for the duration of this today, well done, because we have gone on for longer today than normal, but we have had a lot of information to cover today. And thank you for your presence. Thank you to Gregor and to Jason, today to Robert, who is our BSL interpreter, to the journalists for their questions. And thank you to you. As I say, things get more complicated the further down this road we go, but that's a good thing, because we're easing some of these restrictions. But it does mean you need to take some time to understand what the rules and advice now are. You can find out more information on the Scottish Government website, and please do that. And remember, if you are out and about, make sure you're following the facts. The face coverings in enclosed spaces, avoid crowded places, clean your hands, clean surfaces, 2 metres distance, and self-isolate and get a test if you have any symptoms. And we will be back here tomorrow at 12:30 to cover, no doubt, a whole range of other issues. But in the meantime, thank you for joining us today.